Hey, it's Jordan, joined by Nathan, who was one of many that reached out to me with their story. It's probably something you won't see on CNN. They don't like highlighting these types of things. So you live in Sacramento, and obviously, in the last, I'd say, 4 or 5 days, Corona's been all over the news. But
Oh yeah.
you first started feeling whatever symptoms you had, what, about a week and a half ago, a week ago?
I started feeling my symptoms on the 7th of March.
Yeah, so that's about, let me look at my calendar here. It's a good, yeah, a little over a week ago. So,
It's been a little bit of a blur for me.
and what were your symptoms?
Sorry.
Tell me about what you were feeling.
So I worked on Saturday. I felt great, which is funny. My bosses noticed that coloring in my face was a little off, but I blew it off. I was like, dude, I feel awesome. Like, had a great day at work. Woke up the next day, and I couldn't breathe. I was sleeping on my back for some reason, which I never really do, but I woke up and I had intense congestion. Flipped over on my side, immediately tried to get it out, and then had a coughing fit, which resulted in a splitting headache, and I was sweating profusely. I hobbled over to the bathroom, started coughing into the sink, and the headache was so splitting and so bad. Right when I turned on the light, it felt like I was just going to black out and pass out. Um, so I called my boss because I was supposed to work that morning. I was like, hey, I'm not sure what's going on, but I was already pretty wary of coronavirus. I'm a server at a restaurant in a retirement community. So I was already on alert about it coming over. And I was like, hey, I have all the symptoms. Maybe it's like the flu or something, but I shouldn't come into work. They're like, cool, just let us know because you work tomorrow what your deal is if you're feeling better. So, yeah, I just stayed in bed, rested. Next day, no change. Fever, aches, chills, splitting headache, cough getting progressively worse, congestion in my nose and my chest. Um, so I called them. I was like, hey, it's not getting better. They told me to just take time off indefinitely until I did feel better because they were also concerned. Um, so then Wednesday, I slept for 9 hours. uh, and then probably about Friday, the fever broke, which is still concerning to me because I feel like having a high fever for days on end probably isn't healthy for my brain.
Mm.
Um, but the entire time I was pretty terrified because I am uninsured. And then I started coughing up blood. Uh, I wasn't sure what to do. Around that time is
Have
when
you
CDC.
ever coughed up blood before?
No, no. So I was I was kind of internally freaking out. I didn't vocalize it really to my family. I live with my family because I have a 7-year-old sister in the house. I wasn't gonna worry her about that. But that was around the time that Trump and his CDC friends all showed their little paper at the presser. They're like, everyone can get a test, even if they're uninsured. I called CDC, and they directed me to my county's Department of Public Health, and they broke it to me that I would not be able to get a test because they weren't even told when a date in the future they would be able to start giving people tests. And they concluded in that phone call I wouldn't even have passed screening because I did not come in direct contact with someone that for sure had COVID-19, and I did not travel internationally. So,
Let me cut you off right there. So you are a waiter or a server in an elderly community.
yeah.
Elderly people are the most at risk,
hmm
and I think we're starting to see now you could be asymptomatic. So how would they know if you came in touch with someone who had it?
Exactly. That's the most frustrating part of it to me is that are they're undoubtedly aware of that, and it seems that younger people especially can have that situation you mentioned. And yeah, I work at a restaurant that the next street over is a sprawling retirement community. So most of my clientele are retired folks coming in with their grandkids, family visiting. Maybe they just drove, because it's literally, there's a golf cart path from their community over to my restaurant.
Wow.
So it's like they're funneled there. So it definitely was concerning to me. And I have a great grandpa that I see monthly usually, and he has emphysema from his time in the Navy, and obviously can't go see him. So it's I'm worried for sure.
And it doesn't sound like I mean, you don't look like on death's door, but you sound congested and not quite
Yeah.
better.
Yeah, the cough is still there for sure. I have congestion in my chest. I'm on antibiotics right now, which is kind of part of the story, I guess. I went after I contacted Department of Public Health. They recommended I apply for Medi-Cal and go to the emergency room because I wouldn't have gotten my unemployment even if I didn't see a doctor. So I had to bite the bullet regardless to pay my bills. And basically, I'm kind of just hoping I don't get an ER bill now and that Medi-Cal takes care of it, because I've already had to pay out of pocket for antibiotics.
And what are they giving you antibiotics for if they didn't test you for corona?
Upper respiratory infection. So the doctor concluded, I showed up at the ER. They said they don't have COVID tests for me to even take, and I don't pass the criteria. And then he said that, one second, I gotta let my dog out real quick. All right. So, yeah, he said that having those symptoms for about a week resulted in me developing an upper respiratory infection from coughing constantly and having coughing fits. So that was the result of what I believe was COVID-19. They wouldn't test me.
Well, what is the criteria? I mean, you're coughing up blood, and I don't know, you seem pretty young, so.
Yeah. Well, I'm young, so that's where they kind of drew the line. I didn't travel internationally, and I couldn't pinpoint for them if I did meet someone with COVID-19, but I did tell them I was a server, so it's possible that I did bump into someone without knowing, but that wasn't good enough for them.
And this is pretty alarming to me because, what benefit of the doubt, doctors are learning on the fly about this.
Yep.
So what a week and a half ago when you were in, what they assumed, they might know now is not the case. But several things you were told, we know now, doesn't matter. It doesn't matter if you traveled internationally because people from other countries coming here could be sitting down at your restaurant for all you know.
Exactly.
So it's not it's not like you're not a candidate to be checked because you didn't travel internationally. It's even if you didn't travel, even if you traveled out of your home at this point, you're a candidate.
Exactly.
And the other thing, go ahead.
Honestly, a lot of people do come from the Bay Area up to Sacramento area. They commute because they work in the Bay Area now. It's just too much to even live out there. So there's plenty of ways that someone in the Sacramento area could have been exposed to someone that flew internationally the day before or something like that. And there's no way for us to know that.
Right.
So the fact that they just so quickly, because I wasn't even at the emergency room for more than 2 hours. They very much wanted to get people in and out. Mm-hmm. I asked them how they were doing, like how busy it was. And they told me that they hadn't been hit hard yet. So in my mind, the worst is still to come. Mm-hmm. It seemed like a lot of young men were there with the same exact symptoms as me. They had to be in wheelchairs because they couldn't stand up, but They had us outside of the ER doors because they weren't prepared to intake people.
Mm.
So I was waiting out in the wind and the rain with some people in wheelchairs, waiting for them to call us in one by one
Oh,
into their.
it's good if you have potentially have a highly contagious disease, a virus outside in the wind and the rain.
Yeah, it's no big deal, but yeah, it was shocking. Just they asked a couple questions and they were just like, oh yeah, no, we can't justify giving you a test, even if we did have them available readily.
So
Um,
did you have to be falling over dead for them to give you a test? I'm just curious what their criteria was.
Basically, I had to travel internationally,
Mm.
or for them, internationally, or I had to know for sure that I came in contact with someone, which, so basically I had to travel internationally because the other way, there's no way to even know.
Right. And you seem like one of the people that might, it's kind of like rolling the dice. So
Mhm.
let's use what Uncle Joe Biden said in the debate. This is an emergency. You don't have to pay copays. You don't have to pay anything. It's all free. But if you go and you don't get tested for coronavirus, or the doctor tells you we don't think it's coronavirus, well, that's not free. You're still gonna
Nope.
you already paid
Yep.
a couple hundred, and you might get a massive bill. So isn't
Yep.
that kind of crazy that they classify one thing as worth that we could pay for, but your SOL, if they and they might be misdiagnosing it, by the way, say it's
Yeah.
not coronavirus.
Yeah. To me, it was very much just like, yeah, you might have it, but we're not overly concerned really with you. So we're just gonna try and do the bare minimum, push you out. Um, it was honestly pretty terrifying situation because to me at that point nothing was resolved. I didn't even know if antibiotics would work for what was going on because I had never coughed up blood before, and here I am with COVID symptoms, can't get a test, coughing up blood, and they're like, "Well, we'll just give you this medicine that is even really geared towards the illness." I would say, um, yeah, it just seemed like the bare minimum to get me in, write me some prescriptions, and get me out.
And did
Honestly,
I know they say children are least at risk, but did you tell them you're around a 7-year-old sister?
yep, yeah. I told them that I have a 7-year-old sister in the house. Gave them a rundown of everyone in my home, and they're like, "Well, is she showing symptoms?" And I'm like, "No." So that was a non-starter for them, really.
Wow.
To me, it seemed like there wasn't a lot of in-depth education on what they were actually looking for. It just seemed like they were trying to treat a flu. Um, yeah, it was disconcerting for sure.
Hmm.
And the fact that people like Uncle Joe Biden, literally during the debate and after saying things like that, when I went into the emergency room and I had to prioritize medication, the doctor gave me 3 prescriptions. And right when he gave them to me, I was like, "I'm going to be honest with you, man. I'm not working. I'm probably not going to get these medicines because I can't afford it." And he just like baffled look on his face. He didn't understand that thought process. And I was like, "Dude, I have bills. I don't have that money readily available. Most of my money is in tips, in cash, and I've already been sick for a week. So I've had to spend a lot of my at-hand cash."
Because
And
you're not getting paid if you're out of work.
yeah, I have nothing coming in right now. And literally bills just paid like what last week.
Hmm.
So my account's pretty low at this point. And yeah, so he was very adamant. He was like, "Well, if you are going to not get it, I need you to get the antibiotics." And I guess the severity in him explaining how much it would help me made me prioritize and drop $200 on antibiotics that I don't really have to be dropping during this pandemic. But
You know,
I made it survive.
one thing I find interesting, and I mean, the CDC guidelines or whatever, but I'm not sure they even know everything. A, you don't know if you had it. It sounds like you did because generally healthy. What are you, 20 something?
28.
Yeah, generally healthy
Work
20.
out every day.
Yeah, generally 28 healthy 28-year-olds don't feel fine one day and the next day coughing up blood. But
Yeah.
all right, you're on antibiotics, but you're obviously still coughing a little bit congested. So what if, I don't know, 2 3 days from now you're feeling good enough to like go out, assuming there's not like a shutdown. I don't
Yeah.
know. I don't know. Do you still have the remnants of it? You might still have the remnants of it, and you might be standing on line next to an old person, or So
Exactly.
it's kind of because there are people in Japan actually. It's been reported that have been recontracted it after recovering from it. So
See, that's a terrifying thing for me. Is just how dismissive they were, and how they're not even willing to follow up. Um, After that emergency room visit, the doctor recommended me to a completely different clinic that would see uninsured people,
mm,
and just told me follow CDC guidelines, which I had followed CDC guidelines, and that's what landed me in the ER spitting up blood. Um, so I don't really see how that's going to help me in the long run. And honestly, if it gets to the 21st where I'm actually, my doctor's note says I'm allowed to like go back to work and everything, um, if I'm still congested like this, I'm going to be straight up with my boss and be like, I don't feel comfortable coming in because it's not worth it to me to kill other people just for myself. Um, so
it's all.
I'm going to be in it.
I would also say if you work in a place with elderly people, not only could you transmit it, but you could. I mean, they are
I
more
could
at risk.
transmit it
Right.
and die because I can't afford a second round of antibiotics because I've been out of work for
Right.
half a month and I just paid all my bills. So yeah, it feels pretty dangerous times for me,
Hmm.
honestly.
And what does it say to you? Not to make it too political, but
Hmm.
it's kind of backwards. Most of these states that Biden's winning big, you see on one hand the exit polls show they trust Biden more in a crisis like this than Bernie, yet on the other hand, they all overwhelmingly favor Medicare for all.
Yeah.
So, and they trust Biden during a crisis, even though Biden in his campaign recklessly told people to go out and vote and told
Yes.
them, oh, if you don't feel symptoms, go, you're safe, which is totally against what the CDC is saying. So it
Yep.
just seems kind of half-assed backwards that people are going with the guy who his very policies are what creates the holes you're experiencing.
Yeah. So for me, I was insured in 2015 because I was on my parents' plan. Um, but I was very cognizant that there was a lot of uninsured people. There's people falling through the cracks. My grandmother is a Joe Biden supporter, actually, and she depends on Social Security. And I talk to her weekly, and it frustrates me so much because she doesn't she thinks it's like conspiracies. She listens to like Chris Matthews podcasts.
I literally was about to say, is she watching Hardball?
Dude, yeah, she literally asked me, how can I listen to podcasts on my phone? Because Chris Matthews is starting a podcast. And I was like, I'm not helping you with that. Like, I'm not contributing to that whatsoever. But like, she's had to prioritize oral surgery. She's been putting off getting surgery that she desperately needs because she's retired and she can't afford it. She depends on Social Security, running up credit card bills and stuff because just the things that and the party she believed in have completely abandoned her, and she doesn't really realize it. And me seeing that in my own flesh and blood, like my immediate family, I can see how it can happen to multiple other people. Because when you have people that they feel like they built something with their generation, they feel like they made a lot of progress, and then they have younger people coming in saying, "No, that's not good enough." There's still all of these people that are out on the fringes, and you're not helping them. They clam up a lot, I've noticed, and they're like, "No, no, 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 no. We're helping people." you're just being babies.
So you think it's almost like a little defensive almost?
I do, yeah, because I actually talked to my grandma after Super Tuesday, and I admittedly canvassed for Bernie. I have phone banked for Bernie. I truly believe in Bernie Sanders' platform. I would say that suffering during this pandemic and seeing the establishment as a whole kind of throw us to the wayside just to save face, it's pushed me further left for sure. I wouldn't say that I was far left before, but I would say that it has pushed me further left because I don't feel like they care at all, and I'm potentially dying, or was potentially going to die, and they couldn't be bothered by it.
And I think it's a real. I mean, it's not your grandma's fault. There's plenty of people like her, but I think it's a real indictment because because of the programming that she's constantly listening to, MSNBC, CNN, all these places that feed you this steady diet of, all we could do is, eat your broccoli and give you crumbs. She's going to be having questions for Chris Matthews if Joe Biden becomes president, and as a, quote, grand bargain, like he tried to do with Obama, that retirement, those benefits aren't as good. And he starts tinkering with that. And I think a lot of older people are going to be like, wait a minute here. This is not what you told me.
We got in a bit of a tussle because she was like, well, what are you going to do if he's the nominee? Are you going to support him? And I was like, well, if he adopts policies that will help me and that are important to me, Green New Deal, universal health care, student debt forgiveness, as the government has proven we can fiscally afford. If they're not willing to even lobby for Medicare for all when I almost died from a pandemic, I don't think I'm going to carry water for a guy that wouldn't even go to bat so I don't die from another thing like this happening. I don't understand why I should keep doing that. So yeah, it's changed me completely, and just like his just like lack of empathy, and the lack of empathy from his supporters, pushing both sides of my family are from Illinois. Not thankfully, but all of my elderly family in Illinois have passed away, so they're not voters. I didn't have to worry about them going out and potentially dying voting yesterday. But seeing that, and in Florida and Arizona, just them doing everything they could to push that through when they knew it wasn't safe, and the CDC told them that it wasn't safe. And now today, them being like, well, if Bernie doesn't drop out,
he's making people sick.
Yeah, he's putting them at risk, man. I'm like, what are you talking about? Like, that right there, that is why I'm done. Like, this entire thing has completely changed me. I would have voted for Biden before this because I freaking hate Trump. But if he's not going to help my Palestinian friends go back to their family home, if he's not going to stop putting kids in cages, deporting kids, DACA isn't enough for me. I'm sorry. That's the bare minimum.
Yeah. Thank you for reaching out to me. I'd like to stay in touch to make sure you don't die.
I appreciate that.
And definitely do whatever you can. You're not the only person who's going to have massive bills for no control over it. But definitely keep in touch so we could update the audience.
Yeah, of course. And if you have any follow-up questions or need anything from me, feel free to reach out, Jordan.
All right. Thanks, man.
Thank you.
Hope you enjoyed that last video. Hop on over to statuscoup.com where you can sign up for our email list and become a member for as low as $5 to $10 a month. Membership is how we grow. That's statuscoup.com/join. And remember, join our email list so we can grow the revolution with you.